More than 27% of South African children under the age of 5 are stunted. It's based on a study by the South African Medical Research Council along with Wits University. Now, the study also very importantly found that 69% of women of reproductive age are overweight and 31% are also iron deficient. So there's huge gaps in the country's evidence-based nutrition policies and services. It's a very, very important topic we need to unpack, but we also need the data behind this. So it's a huge pleasure to welcome to the show Agnes Erzse, researcher at the South African Medical Research Council Centre for Health Economics and also Decision Science. It's quite a title, Agnes. Good morning to you. I appreciate your time. So what I'm hearing is a lot of malnutrition, especially at the ages where women would like to potentially have children.
Absolutely. Thank you very much for having me. Hunger and malnutrition stem from a multitude of challenges, and two of which demand immediate attention. First, poverty and inequality are significant contributors. With high unemployment rates, energy crisis, and soaring food prices, access to food becomes a struggle to many. And a staggering 30% of children live below the food poverty line, lacking the means to meet their nutritional needs, while approximately 70% pregnancies occur in impoverished households. And this is a critical period demanding adequate nutrition. And secondly, besides poverty and inequality, a second critical driver is unhealthy food environments that pose a serious threat to good nutrition. And most South African children now live in communities where healthy foods are no longer available or affordable. Fast food outlets selling cheap, unhealthy foods outnumber the healthy ones.
And what do you now do with research like this? Obviously, once you've got the facts, as you've just given them to me now, it's a very, very worrying picture. But what do you hope to do with this? How do you try and change the situation, I suppose, is what I'm asking.
Right. So at Priceless, we're trying to first look at the gaps. Where are the gaps in our systems? And we see three gaps. Firstly, there's gap in the health system. We have good nutrition services, high impact, but we lack adequate coverage. At Priceless, we showed that increasing the coverage of these nutrition services could reduce stunting rates and save thousands of lives. The second gap we see is in the social protection system. Mothers lack strong financial protection against malnutrition. And this results in a situation that mothers and children just unable to consume the variety of foods that they are recommended at the clinics. And even those mothers who access, for example, the child support grant, it's inadequate to cover even basic needs. And then the third system that we see a gap in is the food system. Mothers and children are not protected enough from unhealthy foods and beverages. And the high consumption of unhealthy foods is a risk for obesity, overweight, diabetes, and also low micronutrient intake.
When you talk about the youngsters now, I'm going back to the one stat, and please remind me, I hope I don't get this wrong, that it's 5-year-olds and younger, that many of them are actually stunted as well. What do we mean by stunted? What does it actually mean for a child later in life, in say ECD? What happens when they start getting to their teenage years and adulthood? How dangerous is that?
So stunting means short height for a child weight, and it really has very serious consequences for cognitive development from early on and growth later in life. And stunting also places a child into the risk group of obesity later in life and diabetes. So we see that there's a lifelong consequence for stunting. In fact, a child who is stunted is also at risk of attending school less, for example. So we also see economic consequences, and you know, it's all coming together to have a serious financial consequence both for individuals, families, communities, and society as a whole. So it has social and economic consequences as well.
And so now, as I start saying goodbye to you, what can be done to try and accelerate and close these gaps in malnutrition in our country? What would you like to see happen, just as I say goodbye to you, Agnes?
Right. We wish to see the government expanding cash transfers and assist women financially during pregnancy. At prices we showed that extending, for example, the child support grant to pregnancy has a potential to save lives of babies and reduce healthcare costs by over 30,000 rand per pregnancy. And also the NHI provides a critical opportunity as well. Interventions, firstly to prevent, but also to treat malnutrition should be part of the essential health package for children and mothers.
For the moment, thank you very much for bringing it to our attention. It's some very worrying stats when you start talking about 5-year-olds with conditions of stunting as well. The number of women of reproductive age, overweight and iron deficient. It's all got to do with the data coming out about malnutrition in our country. And I appreciate Agnes Erzse making time for me this morning. She's a researcher at the South African Medical Research Council, specifically the Centre for Health Economics and Decision Science.